IBS is a disorder which causes a range of symptoms from abdominal pain to diarrhea. There is no cure for it, but sufferers can learn to live with IBS by altering their lifestyles and habits. Here are the foods to avoid if you suffer from IBS symptoms. IBS is a disorder that impacts about 2 in 10 people in the UK and about 10 to 15% of the world population. These people get 6 episodes a year on average, but this varies from person to person. IBS is characterized by stomach cramps and issues with the digestive system and bowels. The exact cause is unknown and when symptoms flare up is unpredictable. We will use your email address only for sending your newsletters. Please see our privacy notice for details of your data protection rights. IBS symptoms normally come and go or are worse some days than others. Flare-ups. The main symptoms of IBS are, other symptoms can include, IBS doesn't cause long-term harm, but the symptoms can be a sign of something more serious. Dr. Philip Woodland, consultant gastroenterologist at the Princess Grace Hospital, part of HCA Healthcare UK said, IBS can cause troublesome symptoms that your doctor can often help you with. Any long-term change in bowel habits should be checked, but some signs are important to get checked urgently. Particularly, if the persistent diarrhea is associated with bleeding or if you have weight loss, then medical attention should be sought. Often simple blood tests and stool tests are sufficient to distinguish IBS from inflammatory bowel disease, IBD, where there is inflammation within the bowel and which requires medical treatment. Occasionally, particularly if there is concern about other problems such as cancer, camera tests, colonoscopy, can provide a conclusive result very quickly. Most of the time diarrhea is not due to anything serious, and much of the time any problems found can be dealt with fairly simply. It is always worth taking professional advice if you are concerned. IBS flare-ups can happen for no obvious reason, but a lot of the time they are triggered by food or drink. There is no single diet which works for every person who has IBS, because the symptoms are so different. If your main concern with your IBS is constipation, the NHS site recommends you drink lots of water and increase your soluble fiber intake. Eat foods like oats, pulses, carrots, and linseeds. Someone who has diarrhea as a part of their IBS should cut back on their fiber intake and avoid eating too much whole grain food, nuts and seeds. If you want to ease bloating, cramps and farting, it's a good idea to eat oats and linseeds, but avoid foods that are hard to digest such as cabbage, broccoli, and cauliflower. According to About IBS.org, the foods most likely to cause problems are